All right, Bill, thank you. Well, Indianapolis-based OurHealth is now Marathon Health after merging with a Vermont-based company. Despite inking the business deal just weeks before the pandemic, the on-site healthcare provider says it is continuing to grow at a feverish pace. Business of Health reporter Kylie Valletta is here now with more. Kylie.
Well, thank you, Gary. Marathon Health has two main functions. It provides on-site healthcare clinics for large employers and near-site clinics that can serve a cluster of small to medium-sized businesses. One America and Toyota Industries of North America are just two of its Indiana clients. While the rocky economic climate this year has been difficult for many companies to weather, Marathon Health says it's riding a wave of new business. Marathon President Dr. Jeff Wells joins me now to tell us why the company has been able to expand even during an era of cutbacks. Dr. Wells, thanks for being on the show today.
Yeah, absolutely. Thanks so much, Kylie.
Sure. Let's start with a quick introduction to Marathon Health, and if you could explain its focus on cutting healthcare costs for companies.
Sure. Marathon Health really brings a modern approach to primary healthcare delivery for employers. As you mentioned, we offer on-site primary care health center teams for large organizations, as well as near-site shared locations for other employers in communities like Central Indiana. We've also increasingly expanded virtual care delivery. And ultimately, the whole goal is to really drive improved outcomes for those employers and their employees. So improved access to care, improved health outcomes, and lowered cost of care.
So you merged with Marathon Health in early 2020, just weeks before the pandemic, but it's been a very good year for your company. Can you tell us about the growth that you've been seeing this year?
Yeah, thanks. The first point, we've certainly, endured a very challenging year, no different than any other organization out there. Between the pandemic and all of the issues that's put on just the public health of employees, for all the organizations that we serve, as well as just some of the macroeconomic challenges. And certainly varies by industry. But we feel so proud of our team and the employers that we've partnered with to really work together to navigate the pandemic and continue to deliver, value back to those patients and those employers. And we are really pleased that we've been able to not only grow through the pandemic, but heading into next year, already have added, I think, 25 net new locations. We'll probably grow north of 30%. And I think it's just a real testament to the outcomes and the value that the team delivers day in and day out.
So obviously the pandemic has had a lot of ripple effects. One of those being employers are looking for ways to cut back. Is Marathon Health not one of those things that employers look to cut?
I think this is really the distinction. As I talk to business leaders, across Indiana, oftentimes they initially think that what we provide is more of an amenity or a wellness type of an investment. But very quickly, as we discuss it, realizes that sort of access to an independent primary care team is really one of the most effective ways to help patients lower their cost of care while also improving health outcomes. And so for those individual patients that engage with Marathon Health teams, they save about 25% in the total cost of care compared to a similar group that doesn't engage with our care teams. And so this is really an investment that has an economic return. And so I think particularly at a time where businesses are really, scrutinizing every dollar that's invested, and particularly a large expense like healthcare, we've actually been able to demonstrate that this is one of the most important things to maintain, if not expand. Now, and certainly, the pandemic itself has created maybe even more of an opportunity for employers to think about the role that they play with the health and the safety of their employees.
I know the company says it has two headquarters in Indianapolis and also in Vermont. But if we look at this growth through an Indiana lens, so to speak, what does it really mean for the state of Indiana?
Yeah, I think, the state of Indiana continues to be one of the largest markets for our organization. We've got north of 100 sort of headquarter ambassadors, which is what we call our employees, here in Central Indiana and Indianapolis. We've got numerous health center locations really all throughout the state, as far northwest as Valparaiso and Maryville down to Madison, Indiana, and really everywhere in between. We expect right now to add about 150 jobs. Many of those, probably as many as 50 or so, will be in the state of Indiana. We're also growing in Southwest Ohio, in Cincinnati and Columbus and the greater area there. And there's a number of Indiana residents that live and work, in that market as well. So the Midwest, and in particular Indiana, continues to be a real engine of growth for our organization. And we're excited about, the ability to work in a great state like Indiana.
Okay, just a couple seconds left, but I know you put a big expansion on virtual care. Can you tell us about that quickly?
Yeah, quickly, if you go back to March, we realized for the safety of the patients that we serve and our own clinical teams, we really needed to move away from in-person care for a period of time. We actually shifted in a matter of 2 weeks to 90% of all of our visits were done virtually as opposed to in person. It's now about 50-50, but we've probably accelerated 2 years worth of innovation just by necessity with the pandemic. And amazingly, the patient satisfaction scores are actually even higher in virtual care delivery than they have been in person. We believe fundamentally that both are critical, and relationship-based care really needs a degree of in-person support. But virtual has been a real big opportunity for us to meet the needs of our patients right now.
All right, well, Dr. Wells, congratulations on growing your footprint both here in Indiana and across the country. Thanks for being on the show today.
Kylie, hey, thanks so much. Really appreciate it.
Gary, back to you.
All right, Kylie, thank you.